Leslie, thank you and the team for letting me have this chance just to share kind of a few thoughts on what we're doing as a team at NHS England. Before I go into my own, can I just say, first of all, and I'm sure this has been said already, apologies if I am duplicating what's been shared, but I watched Sarah's presentation and I got to say the work that Sarah's been doing over a number of years, but particularly over the last couple of years, has absolutely brought to the surface the amazing work that goes on at Hills and also around Meals on Wheels. And it's not just about food, is it? It's about that contact point and that those supporting conversations that happen. And it's been rightly so that Sarah's been recognised in the last couple of years for the amazing work that's taken place. Apologies if there's any noise in the background. I'm at a noisy conference centre, but couldn't find a quieter place. So I hope you can hear me clearly. My role as Senior Operational and Policy Manager at NHS England kind of tends to head up a few things around portering and around cleaning, but my main role is National Lead for Food. And then I suppose I was asked to take on that role after leading the food review in 2020, and then to kind of see through the recommendations and why that happened. So I'll pick up on that a little bit, but more importantly, starting to understand how malnutrition actually costs the NHS and the social care, so much, 22.6 billion annually. And we know that the whole care for costing for a malnourished patient can often cost up to 3 times more than a well-nourished patient. So it should be something that is right at the top of our agenda all the time. The stat tells us that 464,000 people admitted to NHS hospitals each year have a disease that is related to malnutrition. That's 50 every hour, which in theory is a frightening figure when we start talking about on an hourly, on a daily, on a weekly basis. So why are we doing what we're doing? Well, the food review kind of gave us that catalyst for a change moment where I hope it brings food choice and presentation as everybody's responsibility. So taking steps to ensure that food provision for the older and the vulnerable patients is not just about nutrition, but it's also tailored to individual needs. In time, it feels that we have lost that individual feeling around care and understanding that everybody is that individual and we're understanding those individual needs. Of course, the messaging is very much underpinned with the strapline that food is medicine. We recognize that the vital role of diet in recovery, around well-being and around dignity. The food review gave us a chance to link mandatory food standards for the first time ever in healthcare. So why does it matter? Well, malnutrition in older adults, it leads to longer hospital stays. It also provides a higher complication rate and, of course, increased healthcare costs. So by improving these mandatory food standards and the choice, the NHS aims to reduce those risks, enhance recovery, and support independence. And to do that, there needs to be accountability. Workforce need to understand their role. We've got to have leadership at board level, understanding that food and drink is at the core of care. Each site needs to have that capacity, whether it is around numbers, whether it's around skills and speciality, but of course also the equipment. And having that flexibility at ward level to be able to support those individual needs. And we're seeing a lot more around innovation now. So it's kind of understanding that what types of areas can we reproduce food in a way that our patients are looking for. Those mandatory food standards for healthcare alongside the digest from the BDA, they create a foundation for a long-term impact. If we don't have that foundation, it is very difficult for us to be able to move forward as a wider NHS. The standards make nutrition a contractual requirement for all NHS organisations, and the standards set clear expectations for quality, sustainability, and patient experience, ensuring that consistency happens across the system. We have something called the PAM, the Premises Assurance Model, and it's interesting seeing those results that came through last week from the second year, where we've captured how people are doing against these food standards. And there's a clear identity that trusts have taken the dietetic role and the food safety role very, very seriously, which is really encouraging to hear. We know that leadership at board level is quite strong, but there are elements of those standards, particularly around training, around 24/7, that we're not seeing the same type of movement. How can we encourage appetites? Well, we've moved to a restaurant style blue plates across the NHS, and that's been led by our chef competitions and by our net zero ambitions. It's certainly what I call, it's driven presentation, it's driven appetite, and it's also reducing food waste, as you can see on the figures on the screen from some of our pilots. We need to recognise that a personalised care within hospitals encourages a flexible meal service with enriched foods and snacks to boost energy and protein intake for our older patients, because often they're the ones that struggle with the traditional supplements. Our wider food programme encourages an integrated approach. So dietitians, nurses, our caterers, our speech therapists, working together to ensure that meals meet the medical and the cultural and personal preferences, reinforcing the importance of medicine as part of a holistic care. And during the chef competitions, we recognise the different styles of meals that we have to face across healthcare. So not only the children, but our elderly and our vulnerable, looking at smaller portions, that real nutritional density, but focusing on that presentation so we can start to understand the challenges that we have with that liaison between dietetics, our catering teams, and the service at ward level. It's important that we celebrate success. And this year, one of our chefs from Guy's and St. Thomas's actually ended up palling up with our apprentice from Stepping Hill in Stockport near Manchester. This happened totally by accident because two chefs had to drop out by accident. But what we saw is that an experienced chef helped an apprentice learn how you can possibly start to create food that doesn't look overburdened on a plate, but actually can look appetizing, can look colorful, and hopefully encourages appetite. Together, we need to ensure that food is at the center of care, is at the center of that social enterprise, that when people start to prepare to leave hospital and to go home, that they actually enjoy their food. They understand what helps their recovery continued, what can also help their appetite. So it's understanding that as a team, we understand the personalized care that takes place. Speaking to those patients when they come into hospital for the first time is really core to understanding each and everyone's food plan, trying to make them feel comfortable in a place that they don't really want to be, but in essence, making that stay as careful and as provisioned as possible, and all the time building up the education for them that when they go home, they can continue to support their own recovery. Leslie, I hope that helps just to share a few of the things that we're doing and starts to touch on some of the
Yeah,
areas that we really want to expand.
I think that's great. Some of those stats are eye-watering, aren't they?
It's it's frightening, and you kind of, you know, the stats are there, aren't they, to support the work that we do. But you're absolutely right. It almost can be quite frightening that it can change your focus a little bit. I
I
think as
think
long as it
so.
strengthens our focus,
I think it does.
you
And
know, I think that's important.
I was interested to hear you say, another person to say, food is medicine. And, there's more work to be done around that. We've really got to continue to raise the awareness that it's that, isn't it? And for you, I think food for everyone is such a huge challenge. Everybody's got so many different needs. But I think you do really well. You and your team, you do well. You do the best that you can for as many people as you can.
Yeah, I think so. And when you look at each hospital setting, we always have understood that one size doesn't fit all. You know, every setting is slightly different.
Yeah.
So as soon as you go on a visit and you step into their setting, then you are really in their hands, you know, and trying to let them decide and describe the best way forward. And then we provide hopefully the expertise and the support that they need.
Yeah,
Because everyone lives in their own bubble in the setting that they work, don't they?
they do.
So it's important that, you know, they are the carers, they're the ones that are controlling what they do, and it's how we help them to improve where they
I
are.
think so. And not to be critical because,
Absolutely.
everybody is trying to do their best in a very, very difficult circumstances.
Yeah.
And of course, it's really the not so good stories that get in the media. And they
Mm.
are few and far between. There's many, many more really positive stories about good food in hospitals.
No, agreed. You know, we have to use the negative as a positive. We've
Yeah,
always tried to do that. And sometimes people will roll out photos from 5, 6, 7 years ago, you know, and it still does make its mark.
yeah,
But I think, you know, it's a bit of a seesaw effect, isn't it? Where we need to try and emphasize the positive stuff that's going on to try and drive an ambition. That's all we can do. And hopefully we'll move
absolutely.
forward together.
And this age UK malnutrition awareness week is an ideal time to do this. So thank you for sharing
You're
everything with
welcome.
us,
Always good
Phil.
to be with you.
Speak to you soon.
Take care. Bye bye
Bye
bye.
bye. So we're going to have a break now. We're going to come back at 11:25. So we'll see you then. Go and have a walk around. I'm cold. I need to have a cup of coffee. And I'll see you in about 15 minutes.